So it had to be 2:30 in the morning, and I couldn't believe what I saw when I looked in the patient's room. I couldn't believe it. Hi there. If you're new to my channel, I'm Dr. Andrea O'Connor, and subscribe if you would like to hear more of my real life medical spooky stories that have happened to me. Or, maybe paranormal. I'm not sure. But so this happened years ago. I was working in a hospital in Phoenix, Arizona, and I was a pretty new nurse. And when you're a new nurse, now I went to nursing school before I went to medical school. And when you're a new nurse, they put you on night shifts. And the typical shift is 7 p.m. to 7 a.m. So one night, regular evening, I get to work. They assign my 8 patients, which is a lot for a med surg floor because you could have anything walk in the door. We have, you name it. We could have car accidents, lung cancer, recent heart attack, even though those would probably be on cardiology and less telemetry, or that unit was full, then they would come to med surg. Post-surgical patients. I mean, you name it, we'd get it. So I get my patient assignment. I'm going to each of my patients, and the one patient I had, he was so ill. So it's still early in the evening, and that's when I try to at least go to all my patients' room, introduce myself, see if they need anything right away, and I let them know I'll be back because then I've got to go and do their full assessment and give them their meds for the night shift. But I go to each one real quick in case they've been waiting since the day shift nurse. And anyway, whatever. This is how we do it in the hospital, at least how we did it when I worked there. So I go in the patient's room. He's so sick, and if you've ever been in the hospital, sometimes if you're debilitated because you're so ill that you can't get out of bed, and the danger of that is getting a bed sore. And I've seen bed sores get so bad you can literally put your entire fist into the sore. Usually it's in their lower back because that's where the spine hits the bed, and you could drop a softball in some of these bed sores I've seen. It's horrific. But they're extremely painful too. And so one way we avoid that is using a special medical bed that has air flowing through it, and the air kind of goes in and out. So it's constantly shifting the patient forward and back and side to side to keep all the pressure points off the mattress so they don't get a bed sore. And then he was naked. And of course, because that's how we do it. When someone's really ill and can't get out of bed, and sometimes we'll use, a Foley catheter, and that's a way to urinate into a tube. And we even have rectal catheters. And so usually they have loose stool, diarrhea, they're not eating solid foods, and it'll actually go into a rectal tube and exit that way. Well, this patient did not have any of that. He was in kidney failure, so he wasn't creating any urine, so there was no Foley catheter. And this patient hadn't eaten in days because they were not even conscious. This patient wasn't on hospice because sometimes it would happen, we would get such ill patients in the hospital and they would just kind of stay with us because they were so ill, there was no one to go to. And I honestly don't know why he was on hospice, because now that I worked hospice, it's so amazing. But I didn't know any better. I was a new nurse. So unconscious, not eating, he's on this bed, and the room was really darkly lit. There was nobody with him, though. There was no music in the room. So I just hope that he was just almost on the other side. And so I did his vital signs. I did his assessment. I'm doing my notes. He didn't even have an IV, though, because when someone's in kidney failure, if you're pumping fluids into them, it's just going to sit there. And they need dialysis to run those fluids off if you're not urinating. But if you're really end stage, it's just torture to push fluids into someone that's hours from passing away. And the day shift told me this nurse will probably pass away tonight. He's really end stage. And so I felt it was my job just to make sure, that he appeared comfortable. I mean, he was unconscious in a very deep sleep. So, as I observed his skin, it looked like he was dry and comfortable. Yes, they're naked because we put them on a little bit of a pad just in case they do urinate or have a little output. It's going on a little pad. And then we can keep them cleaner, easier. And then for them anyway, that we're not constantly ripping clothes off them and putting clothes on them, or even a gown. But sometimes we would just cover them with a gown and then put a sheet over it. And that's how we kind of managed that patient. So as the night went on, I was finished seeing my other patients. And then after midnight, we turn off most of the lights in the unit because it's nighttime and patients, our unit the desk was a round circle in the middle and the patients were all around us, kind of like a satellite. So as we're sitting in the middle desk, we could see into each room. And so we would dim the lights and it was really, really quiet. And I remember one time they told me, because there was like 4 rooms that were at the end of the hallway off to the side and you couldn't see into them. And they're like, oh, that one last room is haunted because the water always keeps coming off and on and the lights go on and off. And I was like, yeah, right. On a separate evening, I actually walked past there and I heard the water on. And I don't even think I went in the room to turn it off. I was like, oh, well, But so the lights were dim and I'm just doing my chart notes. And the night's quiet, see a couple patients in between there, call lights go off, you go in, take care of them. But night shift is all about trying to stay alert, so you're there for your patients. So I'm drinking my coffee, I'm trying to get up and clean, even though nothing needs to be clean, just to stay awake. I go to sit back down, and I look in my patient's room, the one that was really, really sick, on the movable bed, and there's someone walking in and around his room. One thing you need to know about a hospital is it's open to the public. And I know we're trying to make it more secure, but I feel like being in healthcare and working in a hospital is getting more dangerous. I know it was even that way when I worked there, and I don't work in the hospital anymore. But I thought, oh my gosh, someone's trying to either hurt him or rob him. And I was the only one at the desk. The other nurses were in the patient's room because you work in a team. I had one other nurse and a nurse assistant with me. And so I was like, oh my gosh. And I had to get up and go in his room and see what was going on. And the patient that had been unconscious, out of it, not responding, who was supposed to die that night, pass away, he was the one walking around that room. He was up, walking around, no clothes on. And walking around in his room, he's like, where's my bag? Where's all my things? Completely lucid, walking around his room. And I'll just call him Mr. Jones. I'm like, Mr. Jones, please sit down. You're going to fall. Because if you're in a bed and you haven't been walking for weeks, you don't have the muscle strength. You're just going to fall and you need physical therapy. It takes 3 days to decondition. And patients that are bedbound for 3 days start needing physical therapy. And I was like, please sit down. You're going to fall. I tried to get him back in the bed. He wouldn't have it. I tried to get him to sit down and he was anxious. He went to the sink and he was washing his hands and he's like, I need a cup for water. And he was like, I gave him a cup and he was drinking water and just kind of panicking around his room. And I couldn't leave him alone to get someone else because what if he fell? So I'm trying to hold on to him, onto his side. I'm like, please, Mr. Jones, just come on. And I can't even remember how I got him to calm down. I think I got him to sit down. And because in the hospital, we have these they're almost like lazy boy chairs. They're like recliners. I got him to sit in that chair. And I said, okay, I'll get your stuff. Just please don't move. I'm going to get your stuff and be right back. So I run out of his room. I go to get one of the other nurses. I'm like, you're not going to believe this. Mr. Jones is awake and he's running around his room looking for his stuff and he's drinking water. And this guy was on heaven's door. I can't even describe to you what he had looked like. And I said, you have to come back and help me. And so, she's finishing her preparation. I'm like, let me help you finish with your patient so we can get in his room. We finish. We go back in his room. He's back in his bed, like how I had him, out like a light. And so I'm touching his shoulder and gently shaking his arm. I'm like, Mr. Jones. Out like he was when I saw him earlier in the evening, when he was unconscious and doing that really, that kind of deep breath where the exhale takes a really long time. And not Kussmaul breathing. That happens right before you pass, where you have just very shallow breathing and then just one long one. And she's like, well, he's back in bed. He's out of it. I'm like, I promise you, he was running around his room. He was drinking. He was talking to me. He was looking for his things. And she was a much more experienced nurse than I. So we went back to the desk and I'm rattled. And she said, no, that happens when people are about to pass away. They kind of get this last wind And I want to say, and I could be mistaken how I'm interpreting this, in Chinese medicine, there's a name for it. When we learned acupuncture, I think it's the yang that begins to release that energy, and you get a second wind. And he was completely lucid, up walking around, drinking like you just couldn't believe it. And she said, yeah, that sometimes happens. And I said, I have never seen that before. And by the way, I've never seen it to that degree since. I've seen something similar, which I'll share that other story on another video. But I couldn't believe it. So I kept checking on him. My shift goes till 7 a.m. So I'm taking care of patients. I go in to check on his room. He's still out. And so I go home, and then I show up for my shift the next night, and they're like, oh yeah, Mr. Jones passed away. I could not believe it. So that was before I worked hospice, and that was the strangest thing, looking in that patient's room and seeing him walk around, that after being just about to pass away. So thanks for being here, and I'll see you on the next one.